Good morning, ma'am. I'm Jaime R. Rubio Jr., a student nurse from Medical Colleges of Northern Philippines. Ma'am, what do you want me to address you po?
Charlie.
Okay, Ma'am Charlene, may I see your wristband to ensure that I am the right patient? Okay. So, Ma'am Charlene, what language do you prefer to use po?
Tagalog and English.
So, ma'am, today I will gonna assess and review your system. But before that, are you comfortable with your safe right now? Do you need anything like water? Okay, so ma'am Charlie, what is your religion po? Okay, so let's begin na po, no? So ma'am Charlie, how do you perceive your health status right now?
I perceive my health as well because I perceive it so much.
So ma'am Charlie, are you satisfied with your health status right now? Do you have any allergies po? Food allergies? Okay. Do you take any medication right now or vitamins?
Yes, I take my vitamins as well.
So, do you have any difficulty sleeping po recently? Has there been any changes in your weight, either up or down?
Yes, I have been
So, are you satisfied with your current weight performance? Do you have any problems with fevers or chills? Is there any problem with night sweats or unexplained fatigue? So, Ma'am Charlie, before we will proceed to the initial review of system, I will first get your vital signs, specifically your temperature, your heart rate, your respiratory rate, and your blood pressure po, no? Is it okay if I will touch you during this procedure, ma'am? Okay. So, Ma'am Charlene, your temperature is 36.7, which is normal po. The next, ma'am, is it is okay if I'll touch you again for me to get your heart rate. So, Ma'am Charlene, can you put this into your stomach po? Okay, thank you, ma'am. So, Ma'am Charlene, your heart rate is 89 beats per minute and your respiratory rate is 16 cycles per minute po, no? So, ma'am, the next thing that I need to do is to get your blood pressure po. So, ma'am, kindly put this pillow into your tissue. So, Ma'am Charlene, your blood pressure po is 110 over 80 po, no? Which is normal din po. So, ma'am, since we're finished taking your vital signs, now I want to talk about your eyes a little bit because I noticed that you're wearing eyeglasses. So, Ma'am Charlene, when was the last time you went to an ophthalmologist po?
5 months ago, specifically December 15.
Okay. So, is there any pain in your eyes right now? Do you feel it is tearing or dryness po?
Dryness and tearing over.
Okay. So, how about doubled or blurred vision po?
Double vision.
So, ma'am, let's have a check in your eyes using a Snellen chart, and later on kindly cover your eyes using your one hand, and after it is to cover the other one. Then after that is read the Snellen chart using your bare eyes without any blocking. Is that okay with you, ma'am? Okay. So, Ma'am Charlene, kindly cover your left eye and read what is the clearest letter that you can see.
Oh my gosh. ZLPED.
Okay. So, ma'am, the other one po, kindly cover.
ZLPED.
Okay. So, ma'am, kindly read this Snellen chart, the clearest letter without blocking your eye po.
GEODCF.
Okay. So, ma'am, if you are blocking your one eye, is you have a 20/50 vision. However, if you are viewing this Snellen chart without blocking your eye, you have a 20/40 vision po, no? Which is kind of blurry po. Okay. So, Ma'am Charlene, I just want you to look at me directly and do not move your head and just follow the pen light using your eyes. Is that okay with you, ma'am? Okay. So,
Charlene, I observed that your eye movement is normal and I didn't see any abnormal tingling movement during the time when I moved the pen light to the 6 cardinal field of gazes.
okay. So, ma'am, I will check your pupils if it is equally reacted to the light po, na? Is that okay with you, ma'am? I will use my pen light po, na? Okay. So, ma'am,
Ma'am, I can see that your pupils are round and they have equal in terms of size and they constrict as they react into light, no? Which indicates that there is no abnormality in terms of the size of the pupil po.
so, Ma'am Charlene, since we done with your eyes, I will now assess your head and neck po, no? So, ma'am, I will be palpating your head and observe your scalp to see if there is any lump, lesion, and infestation. And also, I will be checking the symmetry and the size of your head. Is that okay with you, ma'am? And during this procedure, ma'am, I will be touching you. Is that okay with you?
Yes.
So, Ma'am Charlene, I observed that there is no any lesions and lumps or discoloration in your scalp, and also I can observe that there is a little bit dandruff in your scalp, and also you are not normocephalic, which means that your head is appropriate to your body size, and I don't see any other abnormalities with that. Wala. So the next thing that I will assess with you, ma'am, is your facial symmetry and your facial nerves. So please do the things that I want you to do. Wala. So, ma'am, kindly smile po. Okay. So, ma'am, kindly frown. Okay. So, kindly puff your cheeks po. Okay. So, Ma'am Charlene, I observed that there is no abnormalities naman po no, regarding in your facial symmetry and your facial nerve. So, Ma'am Charlene, do you experience any headaches these past few days?
Yes po.
Okay. What do you think are the reason why you suffer from headache, ma'am?
Probably because of the weather. Mas lumalang.
Okay. So, ma'am, always remember to stay hydrated and drink your water. So, now, I will assess your neck and allow me to touch you again po to see if there is any lump, bulges, or lesions. And I will assess your swallowing po, no? And after that, I will assess your trachea posteriorly to see if there is any bulging or if it is at the center po. So, I observe that there is no swelling, there is no tenderness, and there is no lumps and bulges in your neck, which indicates that there is no any abnormalities in your neck. So now, I will now check the range motion of your neck, and it's kind of like, look at the ceiling po na for me. So, look at the floor po, to the right po, the right side, and to your left side. So, ma'am, do you feel any pain while doing the activity?
None.
Okay. So, ma'am, I will auscultate your thyroid to see if there is any present root spot, and can you please inhale and hold your breath later on. Is that okay with you, ma'am? Okay. Kindly inhale po, ma'am. Exhale. Inhale. Exhale. Kindly inhale po again po. Exhale. Inhale. Exhale. Okay. So, ma'am, I can observe that there is no any root spot in your thyroid po, no? So, which indicate that it is normal. So, ma'am, kindly raise your shoulder and ganito po. Ganon po natin. So, ma'am, doing the activity, do you feel any pain? So, during those assessment, ma'am, I see that I observe that there is no present root and your carotid pulse is fine.
Since you didn't feel anything while doing the activity, ma'am, I can say that there is no abnormality in your 11th cranial nerve, which is the accessory nerve.
So, Ma'am Charlene, since we're done assessing your head and neck, let's now move on to your lungs po, no? So, Ma'am Charlene, do you smoke cigarette?
No.
Okay. Do you have any history of lung problem like asthma,
None.
pneumonia, or bronchitis po?
Wala din po.
Okay. Do you have any cough right now?
None.
Are you experiencing difficulty of breathing recently?
Hindi po.
How about chest pain po?
Wala din po.
Okay. Do you snore when sleeping po?
Ano?
Okay. So, ma'am, can you take a deep breath and exhale slowly for me? Is that okay with you, ma'am? Okay. So, inhale. Exhale. Inhale. Exhale. So, ma'am, I can see that the diameter of your chest po is, the ratio is 2.1, which is normal po, no? And, ma'am, allow me to touch you for me to assess if there is any tenderness or bulges, masses in your thorax po. Is that okay with you, ma'am? So, can you raise your hand? So, ma'am, I've observed that there is no tenderness and bulges, and there is no discoloration in your skin po, no? As I expect po. So, ma'am, I will place this stethoscope and I will auscultate your thorax for me to assess your lung sound. Is that okay with you, ma'am?
Okay po.
Okay. Ay, ito na. Sige. Hindi. Sige. Hindi. Sige. 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 Inhale. Exhale. So, okay, fine. So, Ma'am Charlene, I heard that you have soft, low-pitch breathing sound, which indicates that it is normal, or in medical term, we call that the vesicular breathing sound, which is the normal breathing sound. So, Ma'am Charlene, since we finished assessing your lungs, let's now move on to your cardiovascular system po, no? So, Ma'am Charlene, do you have any history of heart disease?
Wala po.
Okay. Have you ever had heart attack,
Wala din po.
heart failure? Okay. So, do you experience chest pain for recently?
Wala po.
Okay. So, ma'am, allow me to touch you again to check, for me to check the veins and your peripheral pulses. Is that okay with you, ma'am?
Yes po.
Okay. Okay. So, ma'am, I observed and feel your pulse, and I don't feel any lumps and bulges in your peripheral pulses, and I can see that the color of your veins is normal, and there is no any abnormalities at all. So, Ma'am Charlene, allow me to touch you again for me to put my stethoscope and auscultate your apical pulse po, no, and your cardiac pulse. Is that okay with you, ma'am? So, Ma'am Charlene, I observed and hear that the sound of your pulse is normal, and I don't hear any shrieking sound, which signifies abnormalities. So, the next thing po to assess in your cardiovascular system is your pulmonic area, your Erb's point, your aortic area, the tricuspid area, and the mitral area. And I will place the bell of my stethoscope in order for me to hear those po, no? Is that okay with you, ma'am?
Okay po.
So, Ma'am Charlene, I can hear the S1 and the S2 and the love dub sound of the heart, which is normal. And I don't hear any clicks or extra sounds, and I don't hear any murmurs, which indicates the abnormalities. Since we've done assessing your cardiovascular system, let's now move on to your gastrointestinal system po, no? So, Ma'am Charlene, do you have any history of gastrointestinal problem?
Wala po.
Like ulcer po?
Hindi po.
Okay, so, Ma'am Charlene, when was your last time?
Ikaw.
Ma'am Charlene, when was your last defecation po?
Kagabi po.
Okay, is there any blood present in your stool po?
Wala po.
Okay, do you have experienced difficulty of swallowing po?
Wala po.
Okay, how about pain in swallowing po?
Wala din po.
Okay, so, ma'am, kindly move to supine lying position for me to assess your abdomen po, no? So, Ma'am Charlene, are you comfortable with your position right now? Okay. So, ma'am, I will now inspect your abdomen to see its symmetry and its shape po, no? Is it okay if you will lift ng konti po yung damit niyo? Okay. So, Okay, Ma'am Charlene, I can see that you have flat stomach and they are symmetrical po, no? So, ma'am, the next thing that I need to do is allow me to auscultate your abdomen po, ma'am. So, can I hold the stethoscope and touch you during this procedure? Okay. I observe that your bowel sound are normal po, no? And I don't hear any murmur or any abnormal sound po during the auscultation. So, Ma'am Charlene, allow me to touch you again, and I will palpate your abdomen to check for annulation, tenderness, pigmentation, and for pain po, no? I will assess the pain. So, is it okay if I will touch you again po, ma'am? So, ma'am, during my observation, I can see that there is no any discoloration in your skin, any lesion, and there is no blood present in your abdomen, which signifies that it is normal po, no? So, ma'am, you can now sit po and bring down your Ma'am Charlene, since we finished assessing your gastrointestinal system, I will now ask you 3 questions regarding in your genitourinary system. So, do you have any past problem about your genitourinary system, ma'am?
Wala po.
Okay. Is your monthly period normal, ma'am?
Yes po.
When was your last menstrual period po?
Last month po, mga specific date po is mga March 18 po.
Okay. So, do you experience menstrual pain po ba?
Yes po.
So, kindly rate it from 1 to 10 po. 10 being the highest po.
5 po.
Okay. So, Ma'am Charlene, are you sexually active po ba, ma'am?
Hindi po.
How often do you urinate in a day po?
3 times a day po.
Okay. So, is there any blood in your urine po?
Wala.
So, kapag umiihi po kayo, ano po yung madalas na color po ng ihi niyo po?
Yellowish lang po.
Okay. So, Ma'am Charlene, that's it for our genitourinary system po. So, Ma'am Charlene, let's move on to your hematology and oncology. So, ma'am, do you have any chronic or past disease on hematology po?
Wala po.
How about cancer po? Nagkaroon na po ba kayo ng cancer?
Hindi po.
Leukemia po?
Hindi po.
Okay. So, do you suffer from fever?
Hindi naman po.
How about chills po?
Hindi din po.
Sweat?
No.
Or do you suffer from weight loss recently?
Hindi po.
Okay. So, Ma'am Charlene, do you have any abnormal bleeding or bruising po?
Wala po.
Okay. So, is there any new or grouping lumps on your... What did you do? So, Ma'am Charlene, is there any new or growing lumps or bumps in your body?
Wala rin po.
Okay. So, do you experience hypercoagulation po? Or nagkakaroon po ba kayo ng blood clot?
Wala
Ganun
po.
ba? Okay. So, Ma'am Charlene, allow me to touch po and inspect your skin for me to check for any lesions, lump, or hematoma po sa inyong skin. Is that okay with you, ma'am? So, Ma'am Charlene, I observed that wala pong lumps, bumps, or any discoloration po sa inyong skin po, no? And also, wala rin po akong nakitang hematoma or bruise po sa inyong skin. So, that's it po, no, for our hematology and oncology. So, let's now move on to the OBGYN po. So, do you have any chronic medical conditions such as diabetes or
Wala.
hypertension?
Wala rin po.
Okay. So, have you ever been diagnosed with sexual transmitted infection or STI po?
Hindi po.
How long do your menstrual cycle typically last po?
3 days lang po.
Ma'am Charlene, when was your last menstrual period po?
Last month pa po, specifically nung March 18 pa po.
Okay. Do you experience any irregulatory or abnormalities in your period?
Hindi po.
Okay. Are you sexually active po ba?
Hindi po.
So, do you have any concerns or question about contraception po?
Wala na.
Do you have ever experienced pain or discomfort during intercourse po? Intercourse po.
Hindi po. Since walang sexual.
Okay. So, Ma'am Charlene, have you been ever pregnant before po?
No.
Okay. So, are you experiencing any pain or discomfort in your pelvic area po?
Wala po.
Okay. So, Ma'am Charlene, have you noticed any unusual vaginal discharge or odor po?
Yes, since normal naman po.
Ano po yung mga nakikita nyo or how about, can you describe this smell po?
Malansa.
So, has anyone in your family had a history of reproductive or gynecological issue po?
Wala po.
Okay. The last thing that I will do in your OBGYN assessment po, ma'am, is I will palpate your breast to see if there is any bulges or may bukol po ba sa ating breast po, no? Is it okay for you if I will touch po?
Yes
I'll
po.
touch po. Okay. So ma'am, since you said na wala, hindi po masakit pag pinapalpate po. And I also observed that there is no any lumps or bukol po sa inyong breast, which indicate that normal po ang inyong breast po, no? And that's it po for our assessment in your OBGYN. So the next assessment po is I will assess your neurological system po. So have you had any previous neurological conditions or injuries po ba? Okay. So do you experience headaches po?
Minsan lang po.
How often po na nagkakaroon?
Kapag ngayon po, like sobrang init, nakakapag-experience po ako ng headache.
Kindly rate it from 1 to 10 po, 10 being the highest po.
3.
Ma'am Charlene, have you noticed any changes in your sensations such as numbness,
Wala.
tingling,
Wala.
or loss of feelings po?
Wala.
Okay. So, have you noticed any weakness or difficulty moving any part of your body, ma'am?
Wala.
So, Ma'am Charlene, can you repeat or follow me po? No? Can you raise your shoulders po? Masakit po ba?
Hindi po.
So, yung neck po, no? Try to swallow po. Masakit po ba?
Wala po.
Okay. So, Ma'am Charlene, bubulog po ako, no? Sasabihin niyo kung narinig niyo or hindi po. Ma'am Charlene, ano po yung sinabi ko po? Ulit ko pa, no? So, ma'am, kindly repeat what I've said.
Charlie po.
Okay, sa other one.
Papasa po.
Okay, tama. So, Ma'am Charlene, may ipapaamoy po ako sa inyo, no? Para i-check po yung olfactory nerve niya. So, can you smell this one? Naamoy niyo po ba?
Okay.
Ano po yung amoy po?
Alcohol po.
Okay, tama po, no? So, since we finished assessing your eyes po kanina, and it is normal po yung findings po, and other cranial nerve po, no? So, the next thing that I will gonna assess in your neurological po is, are you able to perform your usual activities or daily living without any problems po ba?
Wala po.
Okay. So, have you had any difficulties with coordination or balance po?
Wala.
Okay. Do you experience any tremors or involuntary movement po?
Wala.
Okay. So, have you noticed any changes in your vision such as blurriness,
Yes po.
double vision, or loss of vision po? So, blurry lang po ang vision niyo and nagkakaroon po ng double vision sometimes po. Is that true po? Okay. Do you experience any difficulty with hearing or ringing in ears po?
Wala po.
Okay. So, have you noticed any changes in your memory or ability to concentrate?
Wala naman.
Do you have trouble remembering recent event or information po?
Hindi.
Okay. So, have you experienced any confusion or disorientation po?
Hindi.
So, our last question in assessing your neurological po, no, is, have you experienced any difficulties with speaking or understanding speech po?
Wala naman.
Okay. So, that's it po for our neurological system assessment po. So, let's move on to your endocrine system po, no? So, Ma'am Charlene, have you been diagnosed with any endocrine disorder or condition such as diabetes,
Hindi po.
thyroid disorders po, or adrenal gland disorder po? Okay. Do you have any family history of endocrine disorder?
Wala po.
Okay. So, have you noticed any changes in your weight?
Wait po. Yes po.
Tumaas po ba or bumaba?
Tumaas.
In your appetite po, may changes po ba?
Wala naman po.
Okay. How about your energy level po?
Sakal.
Hindi po ba pabago-bago?
Hindi naman po.
Okay. So, do you experience excessive thirst or hunger po?
There's po. Kasi syempre mainit po. Yun po.
Have you noticed any changes in your mood such as irritability or depression?
Ano po, yes. Especially po yung mood. Minsan nababago po kasi mainipin po.
Oh. So, ma'am, kindly correct me if I'm wrong. So, mabilis po ba kayo matirita? Okay. So, do you have any changes in your sleeping pattern po?
Yes po. Lalo na nung nag-start ng college po.
So, Ma'am Charlene, have you experienced any symptoms related to thyroid dysfunction?
Wala po.
Changes in hair texture po?
Wala.
Okay. Do you experience symptoms such as weakness,
Hindi naman.
fatigue po?
Wala.
How about dizziness po?
Minsan.
Nahilo po ba kayo kapag stress po kayo? Okay. So, Ma'am Charlene, how often do you feel stressed po?
Kapag natatanggapan na ng outputs and redness.
Okay. So, do you have any regular menstrual cycles po?
Yes po.
Have you experienced any changes in your menstrual pattern or fertility?
Wala naman.
So, ma'am, I will touch you po and I will palpate your lymph nodes and your thyroid glands to assess if there is any lesion, bulges, or masses po, no? Is that okay with you, ma'am? Okay.
Charlene, I didn't feel any bulges or mga bukol po sa inyong lymph node and thyroid gland, which signifies that you have normal one po, no?
So, since we've done assessing your endocrine system, ma'am, let's now move on to the infectious disease po, no? So, Ma'am Charlene, have you been diagnosed with any infectious disease in the past po?
Yes po. I suffered from COVID-19 2 years ago po.
Okay. So, what symptoms are you've experienced before po?
I lost my smell and yung taste po. And then nagka-experience po ako ng fever.
So, when did your symptoms begin?
2 years ago po, I cannot remember when po.
2 years ago po. So, ma'am, kindly correct me if I'm wrong. So, nagkaroon po kayo ng COVID 2 years ago and ang symptoms po na nagpakita is loss of taste and loss of smell as well as nagkaroon pa kayo ng fever. Is that correct po? Okay. So, do you work or went in an environment where you may be exposed to infectious agent po? Like healthcare, laboratory, agricultural work po? Okay. So, Ma'am Charlene, have you had any recent exposure to that may carry infectious disease po?
Yes, some of my family members work on the government, so they are allowed to go outside. So, had to go out.
Okay. So, that's it po, no, for our infectious disease. So, Ma'am Charlene, since we finished in the infectious disease assessment, I will now assess your musculoskeletal. So, Ma'am Charlene, allow me to touch you for me to inspect your overall colors and see if there's any lumps, bulges, or any lesions in your skin. Okay. So, Ma'am Charlene, I have noticed that you have light skin color, no discoloration at all, no lesion, and there is no bulges or lumps in your skin po, no? So, Ma'am Charlene, I'm going to do next is to assess your passive range of motion, where I will put my hands in your joint and you will move it in a range of motion po, no? Okay. So, Ma'am Charlene, kindly circle your arms po like this. Masakit po ba siya po? So, next po ma'am is to raise your elbows up po. Like ganun. Raise po. Masakit po ba siya ma'am? Ang ibaba niya po, masakit po ba siya? Okay. So, next one po is to put your raise up and down po. Ganun. Then, masakit po ba siya?
Wala.
How about po turn po niyo sa other side? Masakit po ba siya? Okay, ma. So, I will palpate your joints po, na? If masakit po ba kayo. So, dito po, ma'am, masakit po ba?
Wala.
Okay. So, dito po, ma'am, masakit po ba?
Hindi.
Okay. Dito po.
Wala.
Here po.
Wala rin.
Okay. Dito po.
Wala.
How about dito? Masakit po ba dito?
Wala.
Okay. So, ma'am, I will again palpate your skin to see if there is any signs of edema po, no? Is that okay with you, ma'am? Okay. So, ma'am, do you feel any sore or pain while doing the activity?
Wala.
Okay. So, ma'am, I observed that there is no edema and your skin, you have a good skin turgor po kasi bumabalik po agad yung balat nyo once na pinapress natin po siya, no? And symmetrical din po yung knees nyo as I observed po. And, ma'am, let's check the range of motion in your knees and feet. So, ma'am Charlene, can we stretch or extend your knees po, ma'am? So, do you feel any sore or pain while doing this activity? Okay. So, ma'am Charlene, can you put your legs down po again? And up po again po. So, nakaka-feel po ba kayo ng pain po? Okay. So, ma'am Charlene, can you move your feet in circular motion po? Masakit po ba while doing this activity po? So, the other one po. Masakit po ba? Okay. So, we'll bring it down po, ha? So, as you said po, ma'am, that you didn't feel any pain while doing this activity, which indicates that there is no abnormalities in your range of motion in your sleep po, no? So, that's it po for your musculoskeletal assessment. So, let's now move on to the mental health assessment po, no? Okay, so, wait lang po, alcohol lang po ako. So, Ma'am Charlene, have you been feeling emotionally lately po?
Yes.
Okay, so what made you feel sad recently po?
Probably depression po. relative, my son is 6
Okay.
months.
Okay. So have you been experiencing any changes in your mood or overall outlook on life?
Wala lang.
So do you often feel anxious, sad? How about irritable?
Yes.
Hopeless or hopeless? Okay. So have you noticed any changes in your sleeping patterns or appetite?
Yes, especially kapag my school stuff, nakakalimutan ko na po kumain at matulog.
Okay. So have you been ever diagnosed with mental health conditions such as depression, anxiety, bipolar disorder?
Wala.
How about schizophrenia po?
Wala.
Okay. So, do you use alcohol po? Or do you drink alcohol po, beverages?
Yes, occasionally.
Okay. So, do you smoke po?
Yes.
Or take recreational drug po? Okay. So, are you currently taking any medication including prescription drugs?
Wala.
How about over-the-counter medication po? How about vitamins po and supplements?
Vitamins.
Okay. So, do you have any problem in memorizing po?
Yes.
So, that's it po, no, for our mental health assessment po. So, Ma'am Charlene, let's move now on to the... 1, 2, 3,
Go.
So, Ma'am Charlene, let's move now to the last system or the last part of the assessment, which is I will assess your skin, nails, and even your hair po, no? So, do you have any skin problems like lesion?
Wala po.
How about rashes po?
Wala din po.
How about dryness of the skin?
Wala po.
Okay. So, do you have changes in your physical appearance no po?
Yes, like I gained weight po.
Is there any change in your nails right now po?
Wala din.
How about your hair po?
Wala din.
Your skin po?
Wala po.
Okay. So, Ma'am Charlene, allow me to touch you for me to inspect your skin, hair, and your nails po. Is that okay with you, ma'am? Okay. So, Ma'am Charlene, your skin is evenly distributed, there is no discoloration at all, and there is no lesion present in your skin. And I observe that you don't have any stretch mark in your arms, but there is the presence of moles in your body po, no? And also, I can see some scars po. And now, is it okay if I will pinch you to test your skin further po? Is that okay with you, ma'am?
Opo.
Okay. So, Ma'am Charlene, I observed that your skin has a mobility and bumabalik naman po siya kapag bumabalik po siya agad once na pinapress ko po. And I saw that your skin is quite thin, which is indicated that it's not, medyo hindi po siya maganda, no? Hindi po siya normal. But we'll ask Dr. Lee mamaya po for the consultation. So, don't worry po, no? So, Ma'am Charlene, may I see your nails in both hands to see any abnormalities po? So, kindly do this position po, ma'am. I observe that there is no clubbing present in your nails. And may I see po yung nails mo? So, ma'am, nakikita ko rin po na yung nail po is nakadikit po siya sa nail bed, which is an indication of good po, no? Maganda po siya. And also, linisan lang po natin ng konti, no? Kasi meron po siyang konting dumi-dumi. So, Ma'am Charlene, I observed that your nails is quite groomed already and it is quite not clean. Linisan lang po natin ng konti and pinkish po siya, which is good po, no? And naka-connect po yung nail natin sa nail bed as I see earlier. And as you do this one po, yung test po kanina is, I can see and assess that there is no clubbing in your nail. And your finger is good. which is good indication po na walang clubby po yung nail po, no? And it is normal. And that's all po, no? So, Ma'am Charlene, that ends our review of system po, no? So, do you have any questions or clarification po?
Wala na po.
Okay. So, ma'am, I will now pass your assessment paper to the physician for your consultation later on. And thank you for your cooperation and just wait for dito, no? And I will give this assessment paper lang po sa physician and babalikan ko po kayo kapag time niya na po. Is that okay with you, ma'am?
Okay po.
Okay, thank you po.
Thank you po.